Mayor Baker?
Here.
Deputy Mayor Van Ness?
Excused.
Councilmember Smith?
Oh, he's definitely excused.
Councilmember Sperry?
Here.
Councilmember Curtis?
I'm not really sure, but we'll excuse him.
All right. Councilmember Herbig?
Here.
Councilmember Danuski?
Here.
Thank you.
If you would please stand and join me in the flag salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item on the agenda is a presentation. I have the pleasure of working with this lady, and now it's been official. She is the new director of the King County and Seattle Public Health District. And welcome, Patty Hayes.
Thank you so much. All right, so do I cue this up or do that? Okay. I will.
Mr. Mayor?
It looks like that we need to approve the agenda. Should we do that real quick while the presentation's happening?
Yeah, you're absolutely correct. I skipped over that.
That's okay.
Hear from Patty, I just sort of forgot.
That's okay.
So if there are no objections, the agenda will stand approved as written. Hearing none, the agenda is approved. Yeah.
Thank you so much. For the record, Patty Hayes, Director of Public Health, Seattle and King County. I am delighted to be here. Thank you so much for the invitation. My goal tonight is to give you an overview of the Best Starts for Kids initiative and answer any questions. I do so appreciate the time on your busy agenda to go over this. And to start with, I did bring copies of the PowerPoint, and then you have it electronically as well. So. Being a nurse, you're not going to be surprised hearing me say that we know that an ounce of prevention is worth a pound of cure. We've heard that for years and years and years, and now we actually have the science that's showing that. It's very exciting to be living in a time when science is actually showing and being able to work with families and children to show how the infant brain develops and how the environments that we have those families in really impact lifelong health and well-being. I've always intuitively known that and looked at the research over time, but now thanks to the cutting-edge research that's going on all around the country, and particularly here at the University of Washington, we're lucky enough to have that right in our backyard. And this last summer, Executive Constantine and a group of us went down to the University of Washington to actually look at some of the latest cutting-edge research. And it was so telling that the opportunity that we had to look at ways of looking and working with families in a new and different way throughout our system. He was committed to developing this initiative and brought together a group of thought partners that included some of the top pediatricians in the county, organizations and foundations, as well as folks like United Way and others who've been Thrive by Five and organizations that have been involved in looking and working in the early learning world. And then as he looked at where the current county investment was, 75% is going towards the law and justice system. And with the research we've got, the county executive felt that the only way to turn that corner, the only way to really begin to make an impact was to change and move a new investment strategy to the very early years based upon the latest brain research and knowing how development happens for the child and the family and the community in which they live. And that's simply how the thought for Best Starts for Kids started. These wonderful thought partners who came together started with this. This is the research from Dr. Heckman, who's nationally renowned in looking at return on investment over the life course. And you'll see that this shows very clearly that the earlier the investment, the larger the return we get on it. Again, I've worked in maternal child health most of my career, and I've seen the impact really good quality programs have for families, but this really looked at it from a return on investment in terms of human capital. And when we look at programs in the prenatal range and in those first 5 years, you can see the difference in the return on investment that makes. And in the next slide, it actually quantifies it for you in our 3 approaches that we're using for Best Starts for Kids. So the first approach is early child development and looking at what can be done prenatally to those first few years. There's a range of $3 to $17 for every $1 invested. And this range comes from the different types of programmatic strategies and the intensity of those programs. So there's a difference between when we do maternity support services, that's a public health service that works with low-income women and their families and really helps make sure that they're not only having their connection to the world of healthcare with an OB provider, to help make sure that delivery is going to be as healthy as possible, but the wraparound services that families in need often have that they need to deal with. Versus a very more high-level investment strategy like nurse-family partnership, and I'll talk to you about that later, but it's a very intense program where you need to be a first-time mother and very young, so we're looking to really work with that family in a very intense way with their home.
Thank you. I didn't want to interrupt here.
Okay.
I just noticed on this chart that we have on the early childhood development return on investment, it's not really, there's no real bullet points under that, what we're looking at, and I was just wondering what were some of the things that you were looking at there. Go ahead.
Yeah, so you'll see in a later slide. Okay. Let me just give you a preview. We've actually done an extensive look. So we're actually not just looking at programs right now and investments in as they stand, but remember we're looking at outcomes and where we want programs to be using this latest research. So this return on investment really is the range of things like nurse-family partnership, it's maternity support services, it's our child care intervention and consultation program, it's developmental screenings, universal developmental screenings, and how that helps make sure that we're identifying children earlier. So for each one of these buckets, I'm actually going to go into a little more in-depth than that. I actually have this notebook that's about that thick, it's about 10 pounds, that every council member has at the county to look at this to give examples of all of it. I didn't lug one here tonight, but I'm happy to share those.
Let the record show that Councilmember Curtis is now here, and Councilmember Herbig.
So at the state level, they passed they are passing the Early Start initiative right now.
Yes.
How closely does this line up with kind of what the state's direction is and where the state money is going to be going?
Yeah, thanks for that question. I met with the head of the Department of Early Learning just a couple of weeks ago. She's very excited about our approach. Our approach is different and actually leverages what they're thinking of doing. Their investment strategy is really to look at the system and the child care world and also making sure that what's called Bright Futures, the developmental screening that's recommended nationally, is put into place. What we can do with their investments that'll go statewide, we actually can leverage that so we go actually a little deeper and do more intense programs that they're not going to be able to afford or go even further. I'll give you an example with child care. So they're going to be looking at formal child care and some informal child care. And they're going to be looking at bringing those child care up to certain standards and the training that will be needed for that. We're really interested in working with these child care centers to the family, friend, and neighbor approach. So we know that 70% of child care is actually occurring out of those kind of bricks and mortar child care centers. So she was very excited that we were going to go wider in that way to make sure developmental screenings are happening across their tools and technical assistance for those family, friends, and neighbors so that they understand that every interaction with a child is a brain development moment. And then also, we can offer for families that are higher risk a level of assessment and consultation if a child's actually having a problem. And we're looking at actually a model where we would have that help for a child care center, and then there could be a referral to a home visit with a public health nurse or some local organization that could do that. That you don't have right now in the system, and that would be an additional thing that we could bring to King County.
Okay, thank you.
Yes. Let me move on here. So we've already talked about this, but just to sum this up, we know that by the age of 5, 95% of a child's brain is developed. And by that time, they're learning things like self-esteem, motivation, and distraction control. Let me center on distraction control just for a minute. A child that's experiencing what's called toxic stress, or an environment where they may be hungry, they may be homeless, they may be experiencing violence, something that causes them to have adrenaline surges all the time. Adrenaline surges are good. It teaches us how to live in the world. But if you have that all the time and you have a developing brain, what happens is a child has a lot of trouble with distraction control. When they enter into childcare, they aren't able to function very well in that environment, and they begin to have disciplinary problems. We're starting to see this. And the latest brain research is showing that that's actually generational, and problems that have happened in the past, maybe to grandma, through what's called epigenetics, actually can affect the next generation. So the fact that we're seeing more of these problems occurring are actually just a really slow shift in our culture and our society and the problems we're seeing. So Best Starts for Kids would be a 6-year countywide levy. The outcomes are really what we're focusing on. Here's the broad outcomes we're going for. And what we would do is really develop these outcomes with the communities and highlight that where we want to go and a rigorous evaluation that you'll hear me talk about. So we want to make sure babies are born as healthy as possible, that children are safe, healthy, and thriving community members, and that communities are safe, welcoming, and healthy. The funding details is that the proposal that went to the council is a 14 cent per thousand of assessed value for the average home in King County, around $400,000 to $440,000. That's about $56 per year. The distribution shown on this slide was and is obviously being discussed with the council, but the important thing for the county executive was that 50% of this go to those early years to drive the investment to prevention and early intervention between prenatal up to age 5. And then 35% of it would be, and I'll give you some examples of this, but would go to those school age years during developmental interventions that we can do for those kids. 9% would be for a community-based intervention that's called Communities of Opportunity, which is a partnership with the Seattle Foundation that I'll describe. And then because we know that we need to make sure we're evaluating and investing and bending the curve we want to do here, 6% of this would go for that rigor. We also know that there are a lot of high-needs communities where the typical evidence-based research has never been tested on those communities. So we want to have the ability with this data evaluation and infrastructure money to actually help do some promising practices and evaluation of interventions in high-needs communities that haven't been done before. There's also an initial investment, as with levies. The first collection before the implementation is done is frequently put either in reserve or it's scaled up. So because of that opportunity, one of the things that's come forward is a discussion around setting up a family and youth homelessness prevention initiative. This is based on Gates research, the Bill and Melinda Gates Foundation research, where if you have a fund that for families who are on the brink of homelessness for some reason, and you have a flexible investment to stabilize them in place so they don't lose their home, you have huge benefits that occur rather than a family having to go into homelessness and then get services. So the example we usually give is that a family that is experiencing domestic violence and the mom is facing losing her apartment or her house, sometimes it's a couple of months of paying for the rent on that home or apartment, or maybe a couple of months of childcare, paying for childcare so that she can get back to work and get her paychecks flowing, can prevent her from ending up out of that home in a shelter and then really unstable for the children and much more difficult for her to get out of poverty. So that's the idea of the Family and Youth Homeless Prevention Initiative. And then there are some dollars set aside if the council is interested for actually some scientific research to forward some of this research that is happening currently. The implementation would be a comprehensive community planning process. The majority of the funds would go out to community-based organizations. We assume the contracts would be competitive, but really outcomes focused. So we're not going to have just a list of types of programs we want and then see who would apply for those. What we're going to do is talk about the outcomes we want and the areas for that investment, and you'll see I'll talk about that. The governance would be a dual advisory body. In the Youth Action Plan, there was a recommendation for an advisory body for investment strategies for all youth programs. And the Youth Action Plan, of course, doesn't just deal with prevention and early intervention. It's across all youth programs. So this advisory committee, if the council chooses to form it, Best Starts for Kids could be part of that rather than setting up a separate structure, and could be nested as part of the work under that. And then with our partnership with the Seattle Foundation, we already have an interim governance group for the communities of opportunity that I'll share with you, and we assume we would be able to continue to use that. So getting to what are the investment strategies for these different sections in the levy. So the first one is before age of 5. You'll see here in red that it says stabilize the maternal child health, that's MCH, public health services. As you all are probably aware, public health had a terrible fiscal problem that we cliffed off last year, and through the efforts of many that I'm eternally grateful for, we got bridge funding for particularly these maternal child health programs, knowing that we would need to find stable funding for those. So somewhere around 12% of the levy would go to public health for these, what I called sort of your platform maternal child health programs that so much is leveraged off of in the community. And those are, as you'll see listed here, maternity support services, WIC, our family planning program, and then the home-based visiting that we do is nurse-family partnerships. Some of the outcomes we want to see are the reduction of low birth weight. There's still a problem with low birth weight children, which have both take a toll on the child, lifelong health, but also with the family when a child is having to be hospitalized over an extended period of time because of an early birth. That stresses the family financially. They often have trouble keeping their jobs at that time. So the more we can do to make sure that we're reducing that is really important. The idea of unintended pregnancies is really about helping families to choose how they're spacing their children. Oftentimes when a family has their child and they're low income. They're interested in family planning services. They come to public health for that so that they can space their children however they want to. So Best Starts for Kids would have that available to families. And then, of course, I already mentioned that we're having some trouble with children in childcare who are having impulse control, and there's actually been a rising problem with children being literally expelled from childcare, which to me seems nuts. To me, that's just a real sign that we have a child in a family that really needs help, and it's not going to do any good just to kick them out of the childcare. So that's a new phenomenon. You've heard about that in school, but that's a real canary to me when we see it. It's starting to happen as young as in childcare. We really want to use Best Starts for Kids with this 50% of the investment, so a little bit for public health to stabilize us, but we're real interested in expanding home visiting and different types of home visiting on a range for families. We also are interested in providing training and tools for child care providers, as I've mentioned. And because of the work of the legislature, they have endorsed what's called the Bright Futures series of developmental screening. And only 30% of children right now access developmental screening as per that schedule. And it starts at 9 months. So we know we have our work to do getting families familiar with this and making those developmental screens available. What we do know is that when we identify a child early on that is having some sort of developmental delay, we can avoid a very high cost set of interventions if we were delayed and it wasn't identified till they're in school and they're not meeting their reading level. It's much more difficult. Whereas if we can do it at the child care center and maybe engage them in a library reading program, that was one of the low-cost, wonderful interventions that worked great in a test of all of this in Connecticut. So we know we have a range of things we can do. We just have to get the information out there to families. The second investment strategy in the school age, this would follow screening and early intervention for treatment for things like mental, behavioral, and substance abuse. So children continue to have their brains developed, actually through the age of 24. One of the investment strategies that were done down in Portland showed that if you instituted access to mental health screening and then teams to help the child and the family if a problem surfaced, it actually reduced the first hospitalization for a teenager, which is an amazingly important thing to do. There's a real stigma that follows children who are hospitalized for a psychiatric incident in those teenage years. So if we can avoid that, it's not only great for the development, but it really is so important for the health of the teenager. We also know we need to be working with schools, improving school nutrition and physical activity environments. We know that we can actually make a big difference. In Highline 2 years ago, we had some money from the Centers for Disease Control, and in just 2 years in working with the school and the kids there, we were able to start turning the overweight and obesity curve in that school. It was really exciting. The kids were exciting. They were jazzed. Teachers were delighted. Families were really excited. And we were able to do that in 2 years. So we know we can make an impact. We're interested for schools that are interested in expanding our school-based health centers. We have 30 of those around King County. We have 4 actually now that are in elementary schools, which can be a wonderful family hub for making sure care is accessed. And then we're really looking at measures, as you'll see here, of reduced psychiatric hospitalizations, reduce youth at unhealthy weight, reduce the use of alcohol, drugs, and the chance of entering the juvenile justice system. The strategy on community I'm really excited about. The Seattle Foundation came to us and said, if we did some seed funding, we want you, the county, to do business in a different way. We want to work with communities, communities of high need, and help find local organizations to build an investment for a strategy for them to build their network and help make their community healthier. based upon what they know needs to happen. So, for example, an area that is experiencing what we call a food desert, or lack of access to healthy and affordable foods, to build the momentum to have the community and community-based organizations begin to explore how to address that and to work with them. So this is a very different way, again, not listing, here's the programs we want, but really working with targeted community-based organizations to, as you see examples here, improve opportunities for physical activity, and increased access to healthy, affordable food, safe places to live, safe routes to schools. So the Seattle Foundation has pledged $2.5 million in this effort. Best Starts for Kids would add that investment from the county to do this so that we can build that investment directly with community-based organizations. This is the only initiative that I'm aware of in the country that takes that comprehensive look of early investment and including the community in which these families live, so that you have the individual focus as well as at the community level. The timeline is the ordinance is with the council right now. In order to put it on the ballot, they need to do it on or about July 20th. And here is, oh, it shouldn't say interim anymore, should it? So I've got to fix that. But there's
Not after Friday.
Contact information. So I know that's a ton of information to throw at you very quickly, but I'm very happy to answer any questions.
Questions? Councilmember Curtis.
I have a lot of comments. I'm a family practice doctor, delivered babies for 26 and a half years, been in practice 33 years. And I totally believe in prevention. I believe in prenatal care. I believe in early detection of childhood developmental disorders. But I have lots of problems with this whole program. So, number one, I think it's misdirected. And what I mean by that is it's got such a wide focus. It like took everything evil, threw it in a big heap, and said, we're going to solve everything. So I think it doesn't have enough focus. I think it's totally underfunded. And the reason I believe that is that if you ask any family practice doctor, give me 20 of your kids who right now I know have problems. I know families who are living on garage floors. I know families who live in cardboard boxes. I know families who did have their 5-year-old kicked out of 3 kindergartens because of attention problems. I can identify these kids and I cannot get any care for them. It is very frustrating as a doctor actually trying to do this. So I would rather see funding to help me. I've already identified these people, and every doctor in Seattle can probably do the same. So to create this big, huge, parallel, expensive system, so $400 million, and we're going to get a comprehensive community planning process after the levy passes. So once you've got the money, then we're going to figure out exactly what we're going to do. I say fund the programs in need now with the children that we know have a problem now, instead of creating a parallel system that is overpromising and I believe will underperform.
So just I appreciate we've had comments about the comprehensive nature in this, and let me just reflect a couple of things. The thought partners that came and met with Dow included some of the leading pediatricians in this county, and as well as others that I mentioned. And one of the things that became really clear is that if you're going to really impact what you're talking about, the research is showing we actually have to take a broader approach. I didn't mean to say that it would take so long to implement something that we wouldn't move forward. That's one reason why part of this is staged, especially with the public health dollars coming right back in and moving forward. We do need to work with communities to identify what works, because some of the programs that we've got are not going to be effective all over the county. But as I've met with folks from the Washington chapter of AAP, they can see that this is a leverage point to get them where they want to go. Now, I totally can see your point about there's never enough money, and I'll acknowledge that too. But I think that the county exec felt that this was the right investment right now, and that he was willing to move forward on. So we'll see, and I'll look forward, if it does pass, of partnering with you, because my heart is right where yours is. I've seen those families too. So thank you.
Any other questions? Councilmember Dusky.
Yeah, I support this. I kind of have the same few of the same thoughts as Milton. Is one of my thoughts is there's so many different programs out there that are kind of scattered, and some are working and some aren't. And how are you kind of encompassing and figuring out what's working and what's not? And like kids in the elementary school, those families have a really hard time right now, even trying to navigate what's where, and how does this kind of wrap around that?
Yeah, one of the team that's been working on this, we've tried to get out to as many places as possible. That's been the strategy, rather than forming a levy where you sort of have a group that sort of travels around and gives comments. We've gone out to the local organizations. What I've consistently heard from families kind of falls into two kind of buckets. I don't know where to find help. I don't know how to get there. Or I'm so overwhelmed by people trying to case manage me that it's just too overwhelming on that. So it was really one of the themes that we've got to figure out how to link these programs that you're talking about, especially effective ones, which is why we need the evaluation piece in this. But also, we really want to move some of these programs forward. The home visiting, for example, there's a number of great home visiting programs that are interested right now in actually retooling themselves a bit towards this new brain science. And so that's what we really want to do, and help them evaluate towards that. So the investment the United Way is working in, is doing in home visiting is a great program, but I think we have the opportunity to build on that and partner with them to move that. So I think it's both of those strategies together.
And have you evaluated the programs that are out in the communities now to figure out which ones are working and which ones are really helping, so you're not reinventing the wheel on that? Or?
Yeah, definitely don't want to reinvent.
I assume if you have a binder that thick, you probably are.
Yeah, some are, but some of these programs that are in very small communities haven't ever had the ability to be evaluated. One of the things that in my career I've experienced is people have funded public health programs, but they've never funded the evaluation of the public health programs. That's why we were so committed to the piece here to be able to do that. But like doula programs, that's when we know they're effective. There's a national model on that. We can build on that for sure.
Okay. And I really like the homeless piece of that. I think that's really important. You see a lot of people losing their houses and then getting help, and so it's a good piece.
Any other questions? Councilman Sperry.
Well, thank you. You've given me a lot to think about. I guess a couple ones. One is I don't really want the 10-pound binder, but I would love to have a link to that, or a link to some of these programs and research, so that I can kind of delve a little deeper into this. And then to Councilmember Curtis's point, being a physician and identifying kids that need help, I used to also work in the schools, and so I was regularly involved with kids that had special needs. And I had a background at Children's Hospital, and I'm well aware of we call them $1 million babies if you have a premature baby. And so I certainly understand that there's value there. But going back to like a child that's been identified that having some need for interventions, maybe through a school or through medical, how would they connect with something like this? I mean, how is that going to serve more people, or how is that?
It's based upon a national model called Help Me Grow, is one approach. And this was started in Connecticut. We were one of the pilot states, and it's in its infancy stage statewide. But what it found was that if you really did a good job with the developmental screening and really identified children earlier, you were able to use more local and less costly interventions. so that the higher cost interventions like referrals to developmental pediatricians, which they found in their work that around 60% of the referrals to developmental pediatricians were probably unnecessary if they caught the kids earlier. So they started seeing this sort of backing down of the cost of the programs that were needed for the children. But it was really based upon aggressively getting in and identifying and working with parents to be aware and taking the parents as partners in this, and not it being such a flat thing where they came into the provider, somebody had it done and then they left, but really beginning to, and now it's beginning to be all online. So we're looking at the utility of that engagement with parents earlier, either through home visiting uses it, that's really easy, but childcare is an ideal place if we have a childcare provider trained to a level where they can help the family with that and then refer in. So it's like trying to create that no wrong door, but that central place. And that's one model you see. And yes, we will have our big thick notebook on the website, and I will get that back so you can take a look at it.
Thank you.
Any other questions? Councilmember Danuski?
You've been talking about the early screening. What are some of the ideas of how to get the families that need this to go to a screening? I know there's language issues, there's, can't get there issues, there's pride issues, and all of this.
Right.
How are you going to get them to this screening?
Luckily, with the way the whole developmental screenings are moving, families are getting to the point where if they are interested on the internet, they can actually access some of this information on the internet, so they don't have to go to a place.
If they have the internet.
So there's lots of people that don't have the internet. There are lots of people have phones. There's information. The Bezos Family Foundation has been experimenting with different ways of getting information out about brain development. So there's so much being explored around this right now. My goal would be that we are where the families are showing up. So in family centers or in communities of color where we're working with either churches or we're working with the community health centers are just a wonderful partner in this. We will be working with the major associations on this. So it takes everybody kind of coming together on it. But if you wait for the families to come, that's not going to work. Yeah. That's not going to work.
Thank you.
Any other questions? Councilmember Herbig.
So you talked about getting more information out to family and friends who are taking care of kids. That's something that's kind of close to home for me because my daughter's always been watched by either my in-laws or my parents. How do you, what's the plan look like to reach those folks? Because it's not really it's a different population that, they're kind of in their own world. I'm just trying to, I'm trying to picture how you're going to be reaching out to a bunch of folks in their 60s and 70s who are watching a 3-year-old run around. And
I know, it's going to be
and then try to unteach or convince them that maybe they need to be doing things differently than they did 30 years ago.
We will be starting with communities and high needs communities in some of this because we know that partnership with churches are really important for a lot of populations. We know that community centers or places where families are bringing children. So one of the things I've been approached by is a number of parks departments who are really interested to go, wow, when you get this started, we're going to have this event, lots of families and kids are there, what can you do? We work with the major organizations that have 1-800 lines for families. So there's Parent Trust, there's Within Reach, there's 211. They need to be armed with this. So I think it's going to be some of those organizations that don't necessarily work with each other right now, but beginning to pull those together. United Way is a really key partner with this as well. So it's going to evolve over the course of the levy with multiple strategies we'll be talking about. But I don't think, we're not going to spend a lot of money on a big marketing campaign. It's not, that's you kind of got to go where people are and build those relationships closer.
Councilmember Curtis.
So in my other role, I'm the medical director for 10 primary care clinics that are part of Evergreen Hospital. And about a year and a half ago, we started doing our training for the structured pediatric development starting at 6 months, and we built it into our EMR. Well, we're in the process of still doing that. So most people, no matter how poor they are, they get some of their well child checks. They don't necessarily get all of them. But you really need to be using the family practice doctors and the pediatricians, because even people who don't go to any community events, they usually will see their doctors for some of those early well child checks.
Yeah, that is so key. I can't agree more with that. And I've been in connection with the chapter around that because they're doing such great work already.
Any other questions? I have a couple. We are very, very active with the First Lady's Let's Move campaign, as well as Kaboom and Playful Cities. So we're huge supporters of improving opportunities for physical exercise in kids. The thing that is been a problem for me is the access to healthy and affordable food. Given a city like ours, we have one grocery store, Safeway.
Yeah.
We certainly don't control what goes on their shelves. How do you see that playing out? So we have choices. I mean, we have to rely on the school system now with their What's Plate from the USDA and serving healthy choices. But frankly, I get very concerned when I see that pizza is, considered. So anyway, how do you see that playing out?
Well, this is the new frontier with working directly with communities on how you see your community and what organizations are here that are in the food world. There's been an organization called the Kitchen Cabinet put together for the county executive that's both farm to table as well as the food world, the food banks, et cetera, to try and address exactly what you're talking about. How do we come together? But it's so unique to the community. There's not a one-stop answer for this. We're working right now in the Tukwila area with the Somali community, trying to experiment with them on how do we really help support them and get culturally appropriate, which is both, I think, an employment piece for them as well as access to foods for their community. So we're interested in really working with, when we get these federal grants and we start, the first thing we do is find that partner. So when we worked with the Highline School District, they were ready to really look at what you're talking about. We began looking at it with those leaders in that area. So we would love to work with you on that for sure.
So we have, during the summers here, a lunch program for children in need.
Yeah.
So we run the YMCA runs it, and so we provide the facilities. And one of the things they do is to make sure the children have fresh food they can take home. So there's fresh fruits and vegetables that are available.
That's great.
And so, how do we get that out to the rest of the community? I mean, we are reaching a very small percentage of children in need, where I think we really need to reach the larger community. And so,
Yep.
we're going to be coming out with information on perhaps how we can do that.
Well, I think that that program you're talking about, I know, is trying to expand as well. Every summer they're looking at trying to engage more organizations to get the word out. I think it's all part of the whole we're talking about here, is how you engage families, how do you get them in their community, how do you support the local organizations like what you've got who are doing a really good job, what are their models, and how do we expand that?
I guess, you and I sit on this committee together that we just had a meeting today with University of Washington Department of Medicine and Harborview. And so, I'm sitting there looking at one of the exercises we did, right? What is public health and what it, and I'm just, you and I need to really talk because I look at what public health is doing and I look at this program and I'm a little bit like Dr. Curtis. We have so many programs out there and this is so far reaching. How do we really affect the kids truly in need? And are we going to be able to do this with this program? So,
Well, it is going to be outcomes based, so we're going to be monitoring and moving forward. So be happy to talk with you more.
but don't misunderstand. I'm in favor of the program. So
I get it.
But I thank you.
Thank you. Thank you so much.
Any other questions? Thank you very,
Thank you
very
again.
much, Ms. Hayes. I'm glad to have you as the new public health director. I think you're going to be a true asset to the department, so thank you. Next item on the agenda is citizen comments. This is an opportunity for you to express your views that are important to you and to the community. We ask that you please limit your comments to 3 minutes, out of deference to those who have worked hard to keep them within 3 minutes. And will the clerk please call the first person?
Mr. Kropf, you didn't sign up, but you were here early. Did you want to speak? Okay, John Kropf. Could you please come and sign in after?
Yeah, afterwards, if you will please go see her and sign in.
Oh, okay.
But afterwards.
Okay.
Go ahead and speak first.
Good. If I may, I'd like to give up my 3 minutes and talk about this, what just happened.
Well, you certainly can. You got 3 minutes. You can talk whatever you want.
Maybe you give me back. Maybe I can make a PowerPoint next week or two. At any rate, Dr. John Medina, written several books.
Could you state your name and address?
Oh,
please?
I'm sorry, John Kropf at Christwood Park up there at 350 North 190th Street in Shoreline,
Okay, thank you.
Old Folks Home.
Thank you.
Dr. John Medina, my youngest daughter, by the way, is a doctor too in family practice, but he's written 2 books, many books, but Brain Rules and Brain Rules for Babies. And out of that, in our Presbyterian Church at U Press, one of the doctors was the doctor at Echo Glen. You know, Echo Glen is where the Reform School is. Okay. So out of that is that the church ran a program for runaways. And what's the number one thing happens with runaways? Alcohol. And the police pick them up and they take them back to their dad, who's alcoholic, and the mother's alcoholic because she can't run away from home. She didn't have any skills. And so that second time around, the police pick up again. But this time, some of them make it into a terrible new thing. So that's twice that they're picked up. The third time they're picked up, they're suddenly to Echo Glen. And there 70% of them have fetal alcohol diagnosis. Okay? So alcohol is a problem with the runaways, and it compounds it, and the statistics works out right. And that is a big problem, and she's not addressing this. It's not being addressed, but I agree with you, Doctor. I was so great what you had to offer. But the thing is, we're not striking at the right thing. We need to look at what Dr. John Medina has done. He's written these 2 books, Brain Rules for Babies, and you can't get into this business without having read those, because the brain grows the fastest from the beginning of the trimester until year 1. And when we have kids that are being born to children, 12, 13, 14 years old, which is another problem with alcohol, basically, then we have no chance of solving that problem. So we have to do something drastic, and my solution is you send that father when he gets picked up by drunk driving to down to Arizona's Sheriff Joe, and you're not going to want to come back. And you let him down there for 6 weeks. When he comes back, and no more easy. The next time they double the bet and get rid of that guy. Anyway, thank you very much, and I look forward to maybe next week
Thank you, Mr.
doing
Croft.
what I'm supposed to do.
Thank you, Mr. Croft. If you will please see the clerk and sign. Thank you.
Elizabeth Mooney.
Hello, Elizabeth Mooney, 5934 Northeast 201st Street, Kenmore. I'm here to say hi. Looking forward to being in Kenmore again. I've been in Utah for a while, being a grandma. So while I was gone, I've been in contact with some of you folks and my friends, and I'm here to talk about two things. One is on the agenda about water quality sampling, and I've heard a little bit about that, and I think that sounds great. And I was just going to say, since it's water quality sampling about algae, that since the King County folks are the sponsors of the birthing channel, maybe you want to ask King County for taking some responsibility and sharing with the citizens before they commit to the sampling plan, which we'd like to see. But maybe they should check for dioxins and some of the other nasty things that are there. I think that might be good use of our time and their money. Okay, so the second thing has to do with a function that was in our city hall, my city hall. I think it was called For the Love of Kenmore. I don't know if I think the adjective is that I'm horrified. I have to be honest, horrified. I talked to at least one of the council members, our mayor. My understanding, and this could be a rumor, I hope it is that our city hall's function is going to provide, on some level, painting of the polluting, disgusting, horrific, asphalt-producing, potential polluter of the water also, of the Cal Portland site. That's a business. My understanding is that it was voted on. I certainly didn't vote on it. I don't even know if that's legal, because what that will do on a large level, every biker will go by and say, hey, the Kenmore industrial plant has been decorated. The Kenmore people love that plant. I don't think that's right. I also think that there were people at that meeting. My friend Janet Hayes apparently was part of the group, and they promoted having T-shirts that would go out to citizens, children, to promote healthy lives. I think if you look deep down on what policies you're setting, if you allow a function that was in our city hall to let the planning commissioner, Dennis Mendry's group, decorate the Cal Portland site, I really wonder if that's even legal, but it's certainly not good for our reputation, especially when there are people that I know and you know are suffering every time that plant puts out toxic fumes and they have to, Cecilia Williams at Ostrom's has to pull out her inhaler. It would just be an insult to those people.
Thank you, Mrs. Mooney.
Patrick O'Brien.
Patrick O'Brien, 6330 Northeast 181st Street. I'd like to second that from Mrs. Mooney. Several times this spring, the concrete plant was in operation at 2 and 3 o'clock in the morning on a Friday night, so it was well into Saturday morning. I've made that aware to our city manager. He says there's no violation. That work was not being done in support of a state highway project. That work, in fact, was going to a hole in the ground in downtown Seattle. So we had a violation of time, of hours of operation, and we had a violation of noise. There was 40 trucks approximately there. There was chemical feed truck putting chemicals into the plant so it could make a special kind of concrete. And there was no police action. I was told by our police force that they would not send anybody to investigate a noise or a time violation in the Kenmore industrial area, and especially if I was the one calling. So I think that's wrong. That's against the law, and I've been ignored on that. And there's a lot of people that feel the same way, but they're not as outspoken as I am. I think you've got a real problem with traffic on 181st Street. You've had to put up a stop sign. You've put in a sidewalk. You need a crosswalk right in front of the library. A lot of people cross right out the front gate and they go over to the teriyaki place, and so yet you need another crosswalk there because people are jaywalking. Traffic is not acknowledging that they're there in some cases, and at rush hour it's a real mess. I've also had people asking for food coming out of the library. At night, when Elizabeth and I last had dinner at the teriyaki place, a guy came out and said he hadn't eaten in like a day and a half, and could we help him out? So we do have adults that are hungry, and if we had some provision, if the mayor could help with that, that'd be great. I know that that's something important to him. So no police response. We also have... we had an incident where we had a contractor from Montana injecting resin into the sewer line along 522. And that's all in preparation of the work that's being done. But they said, it needs replacement, but they're not going, that's a temporary fix. So hopefully somebody put on their budgetary hat and said, if we inject this fiberglass resin in there and we cure it with steam, then that's a good solution rather than digging it up before we do all this very expensive work on 522. And as we've seen on other projects, you wind up digging up the work you just did at some point, and I think that's to be avoided if at all possible. And I just stress that the water quality issue is very important, and that if you had independent people that had an interest in helping select who was going to do the testing and do the analysis or look at the analysis, I think that'd be really important, because a lot of people are very concerned about the methods being used and the sites of selection for that testing. Thank you.
Thank you, Mr. O'Brien.
There's no one else signed up.
Thank you for your comments. Mr. Carlindsey, any comments on Cal Portland and for the love of our cities? And what's going on there? No? Okay. Thank you very much. And thank you, Mr. O'Brien, for your comments. Next item on the agenda is the consent agenda. Is there a motion to approve?
So moved.
And I'll second. All those in favor say aye.
Aye.
Opposed? The consent agenda passes unanimously. Next item on the agenda is a public hearing to receive public testimony on resolution number 15-260, adopting the 2016-2021 Transportation Improvement Plan. Mrs. Overlease, Public Works Director, and John Vincenti, Capital Projects Manager.
Good evening, Mayor and Council members. I'll be presenting the 6-year Transportation Improvement Program for you this evening. As a little bit of a background, RCW requires that the municipalities create a Transportation Improvement Program, commonly known as the TIP. The TIP must show how a city proposes to utilize funds for transportation-related projects in the upcoming 6 years. The TIP also has to be consistent with our comprehensive plan. It is required to be updated annually and approved by council, and this annual update must be approved by July 1st of each year. The TIP, once approved by council, is then filed with the Washington State Secretary of Transportation. The TIP contains a lot of similar information that you would find in the CIP. The big difference that you have is the TIP is more of a planning document. It's not fiscally constrained, whereas the CIP is a programming document where budgets are assigned to each individual project and then it's approved. Normally, the CIP is approved in December, whereas the TIP needs to be approved by July so that it can get to the state in time for them to incorporate it into their transportation documentation. And usually, this TIP lags the CIP by 1 year. Currently, we're through 2020 with the CIP, but this TIP goes through 2021. The TIP that's presented in front of you includes current projects in the CIP and programs. For example, Highway 522 West A and B are in there, West Sammamish River Bridge, the annual overlay program, and also our sidewalk program. I think earlier this year we moved several projects from the sidewalk program into their individual projects, and those are listed individually on the TIP. We also added a couple new projects to the TIP. The Juanita Drive project, which will incorporate new sidewalks and bike lanes from 143rd to the Sammamish River Bridge, and then 73rd Avenue Northeast, which is taking sidewalk and trail improvements along 73rd, along with restriping from 181st to 205th. I do want to note that Juanita Drive has been broken into 4 separate phases. The first 3 phases from 143rd to 163rd are included in this current TIP. The final phase, phase 4, will occur in the next revised TIP as it's coming into 2022. The projects listed in the TIP are consistent with the revised transportation element that was approved back in December 2014. Also required for the TIP is a public hearing. The public hearing was advertised and to be held today at 7 p.m. As of today, we did not receive any comments from the public on the TIP, and since we didn't receive any comments tonight, we are recommending that Council adopt the Resolution 15260 and approve the 2016-2021 6-year Transportation Improvement Program. And if there are any questions, I'd be happy to address them.
Questions? Councilmember Curtis.
Mine is a comment instead of a question. After 8 years on this council, I've just learned the difference between a CIP and a TIP.
Yay, John.
Yeah, it's the CIP, and it seems like to me that the TIP is a little redundant to the CIP, but they have their function.
So, any other questions? Or do you have one? Councilmember Hervey.
So it's great to see projects going in, Juanita, in the out years and 73rd. I'm a little troubled, though, that in our 6-year projection that we're not looking seriously at 68th. It's one of our busiest streets right now. It's totally dangerous for anybody to walk up towards the junior high. I've had to do that walk a couple of times, and it's terrifying. And I'm just curious if there's any way that we could get 68th in some sort of long-range plan. I know we probably can't fund it in the next few years because it's expensive and there's a lot of work that needs to be done. The overlay is getting done, but that's not going to widen the road to add in any room for walkers or bikers or anything else. What are your thoughts on addressing 68th?
So I don't recall that we have 68th in our 20-year transportation element project list. You looked at it more recently.
Yeah, so we have a grant right now that's still being considered to be approved by the state, and it's to put sidewalks.
Yeah, up on 202nd.
Yeah, 202nd,
right,
which hits 68.
But there's still this huge stretch to
Yeah.
get kids to that area, because that's just the next 2-3 blocks off the junior high.
So that project specifically is not in our 20-year transportation element, so we specifically can't put it in our 6-year.
So when do we look at the 20-year element then?
So last year we adopted
Oh, we did?
that.
Okay.
And we listed in that a sidewalk program. We just acknowledge that our sidewalk need, even on arterials, is so much greater than what we can afford with our existing resources.
Okay. The other things that trouble me a little bit are that the neighborhood transportation plans are only budgeted through in this biennia. I can't imagine we'll be done with our neighborhood transportation plans in the next 2 years. So think it would make more sense to have that budgeted throughout instead of just doing it for 2 years. And it's a little, we're making we are making big investments in sidewalks, and we are using up some of our out years funding to fund some of those matching grants. But I'm not 100% happy looking at the line item for sidewalks and seeing zeros all the way across. And I wish there was a way that we could put some more funds in those out years so that we can keep competing for grants and build upon the kind of momentum that we have right now at 202nd and 181st and out on 62nd and places like that. So I don't know. I'd like to see if there's a way that we could maybe rejigger this a little bit and try to get some of that funding in there. I don't know. I'd rather be aspirational than, shoot high than kind of resign ourselves to doing 2 years of neighborhood plans and not putting ourselves in a place where we can't really compete for additional sidewalk grants 5 years from now. Does anybody else? I mean,
I guess along that line, we have spent a lot of money on studies. I think one of the studies we did was from, I believe it was 182nd to the school, and we looked at that and we studied it pretty carefully. And I thought that there was some aspects of that were in a tip at one point. I know we also did a large study on 68th south of 170th to the city limits for sidewalks and putting in turn lanes and turn pockets and whatever. And I thought that might have been on at one time, but maybe it wasn't. But yeah, looking at the project list, it looks to me like we're going to have to go around and start looking at our impact fees that we're charging. Is that the case?
Well, I guess I'll jump in and say next Monday at council is our conversation with Burke Consulting. It's the first step towards a community conversation about the city's ability to fund projects with its current revenue stream.
Right.
And do we want to look at ways to maybe find additional resources? So I think the bottom line is, we took the CIP that was adopted as kind of our baseline, and then John, we looked at the 20-year transportation element that we updated last year and just thought, in a fiscally unconstrained project list, what might be the next things we would attack. And we knew that Juanita was something the community is talking about a long time, have studies on the shelf. So we selected Juanita. We acknowledge there's a very, very large need for sidewalk funding. To me, that's a council question. When we got these sidewalk grants, we were so excited, but knew that was pulling forward a lot of that sidewalk money from out years. We agreed to do that at that time. Should council want to find the resources somewhere, I'm not prepared tonight to say where that money could come from, but that's a council decision, I think. I struggle with, you can put a lot of things in your fiscally unconstrained list, but I think we have to balance that with what could possibly happen versus your list is all of a sudden your 20-year transportation element list, and we know we can't do all of that in the next 6 years. So we were trying to find balance, acknowledging we sure would love to put a lot of stuff in it. I would add, this is a planning document that's required to go to the state. I've applied for all colors of grant money. There's never been a grant that you can't apply for because you're not in the TIP. Grant applications ask if you're consistent with your comp plan, if you're consistent with your transportation element, and being able to say yes is enough.
So I'm glad we're starting that discussion in next week, because I think there's some projects like 68th Street that we really need to look at. And if we're finding, in this my opinion, if we're finding that we're having to look at impact fees that we're charging, and you're thinking of lowering them, then I think that we really better look at that and look at the projects we're putting in, because I think there's some big projects long term that we really need to consider. And I think that's a perfect chance for us to start talking about that, next week. So
your impact fees are actually based on your 20-year transportation
Right.
element list that you adopted. So, and I didn't address the neighborhood transportation plans. We chose a pretty significant chunk of money to budget in this biennium, these 2 years. I think it'll go a long ways. I just don't know how far. So I think it was a good start. And in 2 years, we'll see a lot of improvements in our communities. But we may have to revisit sometime next year during the budget process how well that's working and where we think it'll get us. Because right now I can't say. It's too soon.
Yeah, I guess I was always under the assumption that 68th wasn't a 20-year, because that's how I thought that's what we based a lot of our impact fees on, were some of the larger projects we had. But if it goes in 20 years, you got to have a reasonable shot of getting the funding up for those projects. I mean, you just can't put stuff in there, right?
In the tip.
In the 20-year.
Our 20-year list is what we want to build over a 20-year period.
But you have to have some sort of thought on funding for them, right? Or is it the 6-year that has to be?
It's a 6-year CIP that we adopt that has to have money programmed.
And the TIP doesn't?
The TIP can be fiscally unconstrained.
Okay.
We don't have to have the money in hand or really even know exactly where it's coming from.
Okay.
Which is why, frankly, why we added Juanita. That was our bigger change to our CIP.
Okay, good. I'm looking forward to the discussion, because I think it's some stuff that we need to be considering. So thank you. Any other? Councilmember Curtis.
As I understand the question tonight, this is an issue that needs to be decided by the end of June, right? Don't we need to vote on this?
Yes, correct.
Approve it.
Yeah.
So for us to be bringing up these foundational issues, let's go back and stir the whole pot up and come up with a different answer. I think, to me, it feels like this one should just be voted on, approved, and moved ahead. And then as we talk about budgets, if, as a council, we decide to take money from somewhere else and do more sidewalks or more anything we want, that's always our choice any 2 years. So even if we vote on this tonight, we could decide on more money at the time of budget. Is that correct?
And we can do different projects. This isn't holding us to anything specific. It's the state's attempt to understand what our vision is and where we're heading so they can compile it into larger lists. But I think that's the end of it.
And if we decide somewhere down the line that we do want to revise this, we can revise it at any time. The only constraint is that you have to have a public hearing and get it approved. So, yeah.
Yeah, this is something we approve every year.
So, for example,
6 years.
when we had our West Memmish River Bridge, it wasn't in the state tip. And so we got our $12 million in grant money, and I went to PSRC and I did what they called a tip new. It's a form you fill out and you turn it in, and there's a process to get added to the state tip. So you can add projects at any time, you can modify your own tip. It's a planning document.
Any other questions? All right, so we have a public hearing. And one second, let me get to that. Come on, you can do this. So, I want to declare the public hearing open to receive public testimony on resolution number 15-260, adopting the 2016-2021 Transportation Improvement Program. And I declare that hearing open. Is there anybody wishing to testify?
There's no one signed up.
Anybody wishing to be heard on the adoption of the Transportation Improvement Program and resolution number 15-260? Anybody wishing to be heard on the Transportation Improvement Plan for 2016 through 2021? Hearing none, I will declare the public hearing closed. So, next item on the agenda is to adopt resolution number 15-260, the 2016-2021 Transportation Improvement Program. Is there a motion?
So moved.
And I will second. Is there any other questions, any discussion? Councilmember Herbig.
I will be voting yes on this, but I do think it really highlights our need for additional revenue to really build out the Kenmore that we want long term. So looking forward to the discussion next week.
Any further questions, discussion? Hearing none, please, clerk, please take the roll.
Councilmember Danuski?
Yes.
Councilmember Curtis?
Yes.
Councilmember Sperry?
Yes.
Mayor Baker?
Yes.
Councilmember Herberg?
Yes.
Thank you. 5-0.
All right, thank you very much. Next item on the agenda, Sound Transit 3, Mr. Carlinzy.
Thank you, Mayor Baker and City Council. At the last City Council meeting, right after we met with the Planning Commission under staff report, I brought this topic up and the need for us to weigh in and get involved with the Sound Transit 3 project selection process. If the state legislature grants Sound Transit Authority in this session, then Sound Transit will very likely be going to the voters in November 2016 for round 3 of Sound Transit's long-term projects known as ST3. And we've been thinking about this quite a bit, and we've been talking about this when Sound Transit was updating its long-range plan. And I think it's important for us to have a good, clear message and a defined strategy over the next few months, especially over the next month and a half in particular, but over the next few months actually. But a really clear message on what it is that we are asking for as part of ST3. And also any other groups, the chamber, citizens, neighboring cities, that can also weigh in rallying their support as well. So first of all, I'd like to do 2 things tonight. One is, actually 3 things. One is to talk about the 3 bullet items here on the memo. In other words, the 3 requests or 3 project asks that we are proposing to ask for Kenmore in the ST3. And then briefly talk about a strategy on getting our opinion known and our input to the Sound Transit Board. And then third is a draft letter. So first of all, the 3 projects we are recommending that we bring forward as part of our clear message is number 1, bus rapid transit on Northeast 145th Street. We definitely see a need, and although this is not in the city of Kenmore, we feel like it will affect Kenmore when that new light rail station goes in at Northeast 145th Street near I-5, I believe in 2023, and they're going to start the final design process here in the next few months. When that goes in, it's going to create quite a demand, and a lot of people who are going to be trying to get to that light rail station will be coming from and through Kenmore. And we are worried that there's going to be a bottleneck at 145th. There's a relatively small parking garage planned at that light rail station, only 500 cars. And that's 500 cars given the fact that there's going to be thousands of users per day. And so getting folks to that light rail station in a fast and reliable manner is going to be important as it affects our citizens and also just the flow of traffic here in Kenmore. And we can partner with Lake Forest Park and City of Shoreline and Bothell in promoting that particular project. Also BRT and ultimately light rail on 522. It's proposed that we ask that BRT, bus rapid transit, be installed on 522, and then a study for light rail be included in the Sound Transit 3 package. And lastly, structured parking along the Bothell Way corridor, as we've discussed a lot in the past. The current park and rides are brimming and overflowing into the neighborhoods. And providing additional parking for transit users is a responsibility of Metro and Sound Transit. We're hearing from Metro that they're not in the business of funding more parking. They're more about providing local connections and access. So if we wanted to see more parking, then I think Sound Transit 3 is a good way to go. I'm not proposing that we suggest a specific location for a park and ride. It could be in Bothell, it could be at Lake Point, it could be at both, it could be in Lake Forest Park. But we think that the Sound Transit 3 process and the funding provided could figure that out. This last one is the one I'm most on the fence about, because of the fact that, folks from all over would be coming to use these, and I kind of believe in the concept of induced demand. We talked about the walkable city concept for traffic and how induced demand relates to traffic, but I think it might also apply to parking. If you build it, they will fill it. And if we have a big, massive parking garage here in Kenmore, I can pretty much assure you that folks from Snohomish County and East King County are going to come and drive to it and fill it up. Where I could see one as serving some value is in a business area where it could double as transit parking during the day and then serve businesses and residents at night. And it could be kind of a public-private sector partnership. Bothell is looking at that exact scenario in one of their main blocks in their downtown, where they would get a transit parking garage, but it could also serve a mixed use adjacent to it. So anyway, those are the three projects. I wanted to get your thoughts on this. Are we on the right track? How strongly do you feel about the structured parking?
Councilmember Herwig.
No, I love the first 2 points. I think getting folks to light rail is going to be essential for us in the long run, and having having BRT or light rail on 522 and having and improving that 145th corridor is going to be essential for that. I have to say, I actually think I agree with Metro's philosophy when it comes to the park and rides, though. I worry. I think our time could be better spent in trying to restore local service, or the jitney that you've brought up, something like that in the long run. I was just going on Facebook earlier today, and I saw King County Council member Dave Upthegrove. He and I think the city of Burien, so Burien and King County partnered together, and they put together a little community shuttle that runs, I guess, during peak hours to get folks to the main lines of transit, and then at night picks people up and brings them back closer to their homes. And I think our focus would be better served to be on maybe there's an interesting option there, or restoring the service that was taken away, or making it easier for folks to bike and walk to transit, rather than investing in more $5,000 to $30,000 a piece car storage facilities in the long run. I think we could, from a regional standpoint, get a lot more bang for our buck if we look at other ways to get folks to transit rather than parking. And frankly, if we do get a park and ride in Lake Forest Park, we're going to see 522 get even worse as folks are heading to that. And I think that's worse for Kenmore in the long run. So I'm not a fan of the third point there, and I would love to see that one taken out. But I love the other two. Thank you.
Anybody else? Councilmember Sperry.
Thank you, Mayor. Well, first of all, I want to thank the city manager for alerting us to this opportunity to weigh in on the Sound Transit SD3 project selection. I did read through what they've already identified, and there was just nothing on this corridor at all, nothing at all for 522 or this area, so I really do appreciate that. On the third point about the structured parking, I think that leaving it in, recognizing that, you can always ask, I think it is important, especially with the opportunity of Bothell's redevelopment, and they're partnering with the kind of a shared use thing where they're providing, both parking for a business and for commuters. And every car that can park before it gets to Kenmore is one less car on the road. So, I think leaving it general as a corridor item is good. I do agree that approaching Metro for the local service that helps our citizens get to downtown and get on the bus rapid transit makes sense in the long run, but my understanding is that this particular package wouldn't be dealing with that issue. So I definitely agree with the bus rapid transit. That's really important. So.
Your Honor, if I could respond to Councilmember Sperry really quick, and to Councilmember Herbig. Yeah, the local access idea is in our King County priorities agenda that you approved a few weeks or months ago. And we did have a brief conversation with Councilmember Dembowski about it a few weeks ago, and we're going to be meeting with Executive Constantine here in the next week or two to discuss that, among other things. And Executive Constantine is the chair of the Sound Transit Board, so that will be the number one. This ST3 will be the number one thing we'll be talking about with him when we meet with him.
Councilmember Curtis.
Again, I have a similar concern over the structured parking, and a thought, as long as it's dual purpose, I'd be in favor of it. But I wouldn't want just a huge parking garage that's all it does. So a possibility, you could just change the wording a little bit. One or more of these parking garages, instead of could be part, it's either should be or must be part of a mixed-use development and thereby serve a dual purpose. I think there'd be some, if it was Bothell or Lake Point, where you could park a bunch of people during the day or commuters, and then on the weekend and evening you could use that for a second function. So maybe make that a little stronger to say if we're going to have parking garages at all, it must be dual purpose.
Councilmember Danuski?
I think you're, heading down the right track there. Must be is pretty firm. Should is probably a better. Yeah. Must tends to turn people off. Yeah. And I get the idea of getting the the regional service, but we'd need regional bus service that would really get into the neighborhoods, and we would need sidewalks to get people to those regional services. And unless we actually have a plan to do that seems reasonable, my opinion would be to leave this in and ask for it, unless we actually have a firm plan. But yeah, it is a good idea to get people to park and rides in alternate ways.
So I guess it would be wrong for me to say to Boeing that the wings must not fall off the airplane.
Okay, that might actually be one where you can use must.
A couple of things I'd like some clarification on. 145th Street, the bus rapid transit and the BRT there, that's really short if you think about it. From 522 to I-5, very short distance. Or if you go from 99 to I-5, very short distance. So that seems like a pretty short little corridor to put bus rapid transit on.
Well, if you connect it with SR 522 BRT, then that gives you
same bus or a transfer? Could be
the same bus or a transfer, but having the two connected in concert with each other, I think, is key.
See, I guess what I envisioned was 522 bus rapid transit connecting to light rail at the 145th Street corridor.
I was thinking.
So, but
okay. So light rail going up 145th. Is that what you're saying?
No, the bus rapid along 522 continues on 145th to the light rail station.
Oh yeah.
Sort of like one route, and if you wanted to, it could then continue into Shoreline and come back and make the loop.
Yeah.
Okay. Structured parking. I mean, I really see that as a potential boon for economic development. I mean, if something like that were to happen, say, in the future Lake Point or one of the other areas that we have zoned, we're well on the way of getting ourselves 3 blocks and 20 businesses. So hopefully, as businesses start developing here, by having a park and ride, we may actually get some of the people to actually stop and eat or shop right on their way home. So I see that as sort of a boon to economic development. The fact that we have structured parking available, like you had indicated, dual purpose. So the business in the evening and park and ride in the daytime. So I'm kind of supportive of that one. I've been in touch, as I told you, with the president of Cascadia. We're going to have this conversation of how we can get him behind this and the students at Cascadia supportive of this to sort of help with this outreach that we want to do, the community outreach. So.
Yeah, so I would like to talk about that next. But before we do, can I get some consensus on the projects?
I certainly agree with the 3 projects.
I think you only have one no on the third one. So.
Councilmember Curtis.
I guess my only comment, number 1 and number 2 are sort of like must be done together. If you only did number 1 and number 2 never happened, it's like, what's the purpose?
Yeah.
So I don't know if there's a way to sort of say these 2 are 2 pieces of the same project, really.
Yeah, that's a good point. Chris, can I have you come and give your unblemished thoughts on the parking garage? You've articulated some really eloquent and well thought out points on the parking garage. Don't hold back.
Well, Rob and I were talking late last week, and I too prescribe to the induced demand philosophy. We know there's going to be a 500-car parking garage. And we all know park and rides are full. They're just starting to be full really, really early in the morning. So the conversation we had was we just have to be careful to not be in the building facilities for commuters. That was the part we didn't think was ours. I do like the shared use type of garage. But, you know, we had one of our interns not too long ago look at parking downtown. We actually did an inventory and we looked at where parking was. And I was trying to follow the train of logic. If we build a parking garage, it's full during the day, we're still going to have demand for our on-street parking by commuters. So I guess I felt like we have, we're going to have induced demand, whether it's a parking garage. And I just want to make sure we don't look at a parking garage as something that's going to protect our own on-street parking. It's just not going to happen. Because I guess I kind of had that mentality for a while. We get a garage, then you won't have commuters using our on-street parking. And if you subscribe to the induced demand philosophy, you'll realize quickly that, if we let it, commuters are trying to do the right thing. They want a place for their car, so they don't have to take it in town from a time, money, all sorts of impacts. So I just think that we're probably getting closer to needing to manage our own on-street parking. As staff, we haven't wanted to take that leap because once you put up signage restricting parking, you're automatically in the enforcement business, and that's not something we have the resources to do right now. So that kind of was our conversation about, parking garages, if they're shared, maybe not a bad thing, but just exactly what you said. You need to get people to 522 walking and biking, and with transit, some people with their cars, okay. But you need all of those things working together to get people to the buses on 522. And then I believe that the only way our community is going to have speed and reliability, specifically to Seattle, is getting them on bus rapid transit to 145th so they can get downtown. It'd be great long term if we could have one bus route that took you down 522 and across 145th, but my observation is that, you build the facility and those things come. Did I hit all the points that we talked about?
I think so, yeah.
So we're supportive of these 3. So that's 3-1.
So one more thing, and I know Councilmember Danuska wanted to say something. Go ahead.
Yeah, when I was reading the first 2 bullets, I'd actually, in my mind, assumed that it was 522 to 145th as one route. That's kind of how I thought of that, but you want to put it into 2 separate routes? Just to there and transfer and then go over?
If they transfer, that just slows it down. You'd be better off just going right into town.
People will just take the 522 at that point?
Yeah, this is helpful. We've been thinking of them as 2 separate projects. Chris, what do you think?
Well, we want the infrastructure and we want that bus lane in place. And so for me, as clear as we can be that when 145th is revisioned as it is now, we really needed to have dedicated bus facilities. To me, to me in my head, it's not as big of a deal yet. Is it a Sound Transit bus system? Is it Metro, Bus Rapid Transit? But I think if we get those dedicated bus lanes on 145th, we're going to get that speed and reliability, and the bus service will come.
So one thought is the 145th project has lots of things against it. It's multi-jurisdictional. There's confusion there. There's big-time right-of-way issues. If they build a BRT lane, it's going to be super expensive because they're going to be tearing down apartments and buildings and businesses to get it. So to join the two might be harmful because what if one fails? Does that mean the other one fails? So I'm inclined to keep them separate.
Well, yeah, I mean, bus rapid transit on the 522 corridor would be great. But bus rapid transit, by definition, there's hardly any stops, right?
Well, those stops they're separated. They're not as close together. And you have more frequent all-day service. You can kind of walk out to the corridor and know within, a designated amount of time you'll grab a bus.
Are you envisioning like the current 522 route that basically hits everything to 125th Street and then continues on downtown with no stops? Or do you look at reducing that number of stops here to get downtown?
Well, I think there's probably going to be baby steps, because before you know it, we'll have light rail to Northgate. And so instead of having to take bus rapid transit all the way downtown Seattle, over time, you're going to just need to get to Northgate so you can take light rail. So I actually also sit right now, I'm on the committee for updating Metro's long-range plan, which is going to look at the circulation versus AM, PM peak. It's going to look at all the things we've been talking about tonight. And a specific question is, why doesn't 522 have bus rapid transit now? We have it on Aurora. The volumes of at least cars are lower. There might be something about Aurora that I don't know what makes it a better candidate. It could just be they had to pick so many when they started bus rapid transit that I think they're up to A, B, C, D, E, F, like 6 or 7 lines. Councilmember Herbig, I don't know if you know exactly how many there are. So I'm very curious as to why not 522. I think that's a really good, legitimate question to ask today. Given our condition today, why can't we have bus rapid transit on 522 without anything else changing? But by definition, it's further spacing for stops, and they're more frequent.
So we're asking for a bus rapid transit on 522. Where's it going to go? We're going to start out in Woodinville, let's say Woodinville, Bothell area. That's where it starts. Where's it going to end?
Well, the goal is to get downtown Seattle.
So it's going to go to downtown Seattle. So you're envisioning then, at least to start, we're envisioning a transfer at 145th or a transfer to get on another bus to get to the metro station at Northgate, correct?
Frankly, I'm not envisioning either. I'm envisioning getting the dedicated infrastructure on 145th Street so a bus can be in a bus lane from here to the light rail station, and it's a service decision by Metro or Sound Transit. Okay. So I wasn't intending to dictate service provision from in our request to Sound Transit as much as getting the dedicated infrastructure so that we can have speed and reliability to the station.
Okay, so the ask then is for bus rapid transit service on the 522 corridor and ultimately light rail on 522 from where it starts now to downtown, period. Fine. Councilmember Curtis.
As I read that first section again, I really hadn't got the emphasis that the last sentence is kind of the punchline. What we're asking for is lanes and facilities. So rapid bus transit lanes and facilities. So the rest is kind of explanation. So I don't know, maybe we could bold that one little phrase. That's really what the ask is in number 1.
Yeah, we want Sound Transit to spend, I think, as Rob mentioned, I think everybody understands that 145th is owned at the center line by Seattle. The north half is unincorporated King County. And then Shoreline doesn't start until the the parcel boundary for the properties. So Shoreline has the goal of taking ownership of the whole entire road and leading the improvements that we are talking about. However, our understanding is there's a lot of things that need to happen, and that we understand they would start from Aurora Avenue, Highway 99, and work east to the light rail station. So having something from the light rail station to 522 that Shoreline will manage, it's going to be a really long time, very political, a lot of jurisdictions. So having it in the Sound Transit package, they're an overarching agency. They can buy right away from who they need to buy it from. I think that, kind of hedging our bets, it would be great if Shoreline was able to accomplish it all. I know they'll do their best, but if you look at Aurora Avenue, the work there, Shoreline incorporated in 95, here we are 2015, and they're almost done with their Aurora improvements, from visioning to last sidewalk poured. So, they've done a great job, but I think we can still keep working with them to have them do that, but having it in a Sound Transit package might be better.
Councilmember Danuski.
Okay, so the second bullet, then it's not really correct saying projects from Bothell Way from UW to 145th. We're really wanting light rail, maybe just say along the 522 corridor. Because we don't want it just to stop at 145th, right, is how we just talked through that.
Is that the light rail study?
Well, okay. As a result.
Yeah, it says.
Oh, okay. Well, okay. Okay, well, I guess it says 2 projects from Bothell Way or from UW Bothell to 145th. The way it's worded just kind of sounds like.
Right.
I had assumed that bus rapid transit stopped at 145th. Or actually, how I assumed is it took a right and went to the light rail. But, just some wordsmithing.
Yeah, I see what you're saying. Yeah, we can work on that.
Yeah.
It sounds like what's confusing us is just the bus rapid transit language. We could maybe take a different approach and just say we want dedicated transit facilities on 145th Street, and we want a light rail as bullet 1, and then we want a light rail study for the north end of the lake. Because we don't know if light rail might come from Northgate, if it would come off of 145th. I don't know. I wouldn't assume it would be. I would leave it open.
Don't we want BRT along the 522 corridor, period?
Yeah, I'd like to keep BRT in there because especially Shoreline wants it, and we're trying to partner with them.
Well, there are 2 things. BRT on 145th, fine. I don't have a problem with that. But it's the BRT on 522. I'm reading it like Councilmember Danuski said, stops at 145th.
Yeah, we can take that out.
And I'd like to see BRT on the 522 corridor, period.
Period, yep.
And then, the consideration and study for light rail.
May I offer a word of caution? You can have bus rapid transit without dedicated bus lanes.
Right.
You have rapid transit on Aurora Avenue with bus lanes. You get into Seattle and you don't necessarily have them. So I would be careful not to say you just want bus rapid transit. You want the dedicated transit facilities. You build those, you're setting the stage for the bus service, which is bus rapid transit. The infrastructure that goes, you're talking buses and new stations to implement. You could implement rapid transit today with different stations and more frequent buses. You don't have to do any more improvements to have bus rapid transit. It won't be as rapid than it would be if it was in dedicated lanes, but I think it's the lanes we want.
Yeah, but we 3 sat in this conversation the other day at Seashore. With what is happening on Lake City Way at 145th Street to I-5, you're never going to have true BRT in that corridor. It's just not going to happen. And that's why the Shoreline wanting BRT on 145th Street makes so much sense. Because in order to move people effectively out of the East End, a BRT on 522 and onto the 145th Street corridor makes perfect sense. But I understand it's in 2 projects, and fine, I certainly can live with that. Councilmember
Yeah, and I would just argue that, and I would say that BRT without dedicated lanes, without dedicated facilities, is not really BRT. And we don't want what a lot of folks are seeing in Seattle, where buses are caught in traffic. We want, on 522, dedicated lanes. And frankly, right now, that would still require some right-of-way acquisition and LFP to really make it happen north-south. So I think it's great.
It'd be BST, bus slow transit.
Yeah, and that's not what we need. That's not what we need.
Councilmember Danuski.
Okay, so the second bullet now is kind of changed from BRT on 522 corridor to the facilities to support BRT from Bothell to 145th. Is that kind of what we were? Okay, so maybe the word facilities or something goes in there. I don't.
Yeah. We'll fix it.
Anyway,
we got it.
No, I get
We're
it.
advocating then
Yep.
bus rapid transit 522 corridor to 145th Street, correct? Nothing after that. Okay.
But we still are asking for the light rail study.
Yeah.
Yeah. Just don't try to get them all in one sentence.
Okay, and I'm hearing structured parking is in there, but change could to should on the dual purpose. Okay. All right, on to the next topic, which is the strategy portion of this ST3 discussion. And so you see on page 2 of the memo 6 strategy points. Number 1, get a talking points document, a glossy, if you will, a fact sheet, whatever that is. Write letters, meet with board members, and rally the energy and support of other stakeholders and citizens and businesses. And then we're proposing to hold a community meeting on June 17th. It's a Wednesday evening, to try to help our citizens see the importance of this and hoping that they'll get behind this issue. To help with that and rallying the support of our citizens and groups, I'm looking to hire a firm that will help us with this project. We have some consultant savings and some other projects this year, namely the ADA feasibility study. That's coming in under budget, and I can use some of that savings to bring in a kind of a community organizing consultant to help us. I'm talking to Langton Spieth, and they were a key player in the Move Bellevue Forward campaign, which also was a light rail issue. And they've seen a lot of success in helping communities. For about $15,000, I can get their assistance with us for this part of the summer through the July 23rd comment period. So they'll help us with the June 17th meeting, they'll help us with the messaging, they'll help us rally the community, that type of thing, and they're pretty well versed in all of that. Any other thoughts, ideas on this strategy?
Councilmember Sperry?
Again, thank you. I do think that bringing in someone who can help with this effort makes sense. I do have a specific question on the June 17th. Are we going to reach out to our Bothell and Lake Forest Park neighbors for this meeting? Mm-hmm. Great.
Yes. Yeah.
Any other questions? Oh, Councilmember Herbig.
I am just a little wary of the $15,000 price tag we're talking about for some basic community organizing. I don't know if I quite see the value, or that much value, and I should say. I see value in bringing somebody in. I'm not sure if I see $15,000 worth of value between now and, 6 weeks from now. I mean, what outcome are we really hoping to get from this contract?
What we're hoping to do is get people's attention and help them get committed to getting involved with this. Having a defined, organized group that's not the city, that's more grassroots, is going to be crucial in getting our message across to the Sound Transit Board. So that's a rough number right now. I'm in negotiations with them on what their hourly rate is and what the deliverables that they'll actually produce. So
Councilmember Danuski.
Would Bothell or Shoreline be interested in going in the pot on this?
Yes,
consultant?
I'm definitely going to be asking them. Yep.
Doesn't seem like we should pay it all if we're a
Right.
big group of people.
No, if they're not paying, then it's just a Kenmore project. Yeah.
Councilmember Herwig.
How are things going on getting our partners on 522 on board with the letter? I know we had last week when you brought this up, there were some road bumps we had hit. Has there been any movement with that?
So Bothell, my conversations with the Bothell city manager are fine. He's in favor of what we're proposing. Same with the city manager of Shoreline, although I haven't had a talk with her about the park and rides yet. But and then I have a call into the city administrator for Lake Forest Park, and don't know exactly where they stand on this.
Okay.
If I may need your assistance with Lake Forest Park in contacting your counterparts in Lake Forest Park in particular. So stay tuned on that.
Yeah, I've had some of those conversations, and
Yeah.
that, so, yes. Anything else?
So lastly is just a draft letter that would go out, and I'll make those adjustments to the project list that you mentioned earlier. But this draft letter that's a few pages in is to Chair Dow Constantine and the Sound Transit Board. So I just wanted to bring that to your attention. It may be modified to include the 4 cities if we can get them to, or we may use a draft produced by Shoreline. Also, one just last little thing I want to point out. If you go to the kind of the PowerPoint presentation that's attached, this was given at the May 28th Sound Transit Board meeting. If you go to page 11 of that, I have a couple of asterisks towards the bottom there. So the first asterisk, PR5, talks about the 145th issue, so that's good that it's actually listed. And then PR6, Northern Lake Washington HCT crossing study. So I thought that meant us. I thought, wow, great, sweet, we're on the list. So we asked Sound Transit staff about it, and they said, well, actually, there's a group out there, I forgot their name, they have a funny name, but they actually are proposing to do a submerged tunnel on the lake bottom of Lake Washington for transit. It would be kind of somewhere on the north end of the lake, north of 520.
Yeah, they're actually looking at Sandpoint into Kirkland.
Okay. And so that's what that means. But they said it could also be construed as looking at 522 as well, but that wasn't why it was put on there. But they said that, yeah, 522 could be also part of that North Lake Washington crossing study. So it'd be like driving in a submarine, taking you across the bottom of the lake. I thought that was fascinating. So, okay. So next week we have some important items on the City Council agenda. One is Sound Transit staff will come and talk to us about Sound Transit 3, what the process is, and things like that. Also, we do have, as was mentioned earlier, we have Burke Associates coming and talking about the community outreach process for transportation and parks funding. So it's going to be really important and significant evening, but I have something even more significant to attend to that night, and it does start at 7 o'clock in Everett. My son is graduating from Inglemoor High School. So you will be in good hands. My coworkers will take good care of you that night. So, And I just want to point out, just while I still have the mic, the state track meet was held the week before last, and we had two Inglemore students get state championships. And Inglemore placed 5th in state overall as a high school. But we had Michael Rhodes. He took state, first in state in the 400-meter dash. And Mills, what's her first name? My son's going to kill me. Anyways, Miss Mills took state in a couple of hurdle events, and she's going to UW, and she's got a bright future ahead of her. So, Darian Mills, there it is, Darian Mills. So, if you want, maybe we can have him show up at a city council meeting, and we can pat him on the back. Mm-hmm. Also, at next week's council meeting, we will be recognizing Dr. Church, and Nancy has ordered a plaque with the key to the city on it. So that'll be a nice event. We'll break for cake, or you guys will, and we'll have people from Bastyr, and it'll be a nice event. So,
great.
Okay.
Comments? Councilmember Sperry.
Thank you, Mr. Mayor. You looked this way, and I thought, oh, he's going to switch it up. He's going to go the other direction. I wasn't sure. You had me going there. One thing, I appreciate the discussion today about the transportation projects, and a couple of times 68 sidewalk project was brought up. So I'd like to request is to dust off that study and the price tag or something like that, so that maybe we can take a look at that in preparation for our discussion. What I remember was it's more of a wall project than a sidewalk project, and I remember $14 million. So I don't know if I'm right or not, but I think that would be interesting to review in preparation for that. Thank you.
Member Curtis.
Nothing to add.
Councilmember Herbig.
He's speaking
You trying to catch us off guard today? Nothing to add.
Councilmember Danuski.
Nothing new.
So I've got a few things. Was at the Ted Hauk Regatta in Green Lake, where our canoe and kayak club was well represented. I think we finished well. So I was very proud of of our people's showings, and it was nice to hear Kenmore's name mentioned. And so it was a fun event on Saturday. I really appreciated that. Okay, I got to be one of the luckiest peoples around. I really do. We had a breakfast maybe a month ago, the National Day of Prayer, and I met the pastor from the Romanian church who invited me to come up there. I went up yesterday, up right next to Morelands. I'm telling you, what a fantastic group of people. It's just amazing to know that we have those type of people in our community. They have a band, young kids, talented. There was, I believe, 7 guys that got up and sang a song that they dedicated to me. And they would have gotten a standing ovation at the Grand Ole Opry. I mean, it was just outstanding. I really want to see them come here during our tree lighting ceremony and perform like some of the other people we have. Just amazing group of people. No, it was in English, and they sounded like they belonged in the Grand Ole Opry, I'll tell you. But there was other things that was in Romanian. It's quite interesting to go to a service and, it's done in a different language, and you can have the translation in your ear, whatever. It was really good. I was so happy I did that. The food trucks. We had Chicken Fix here on Saturday. Good food. We had Maximum Minimus here today. They sold out in a little over 45 minutes. They were supposed to be here till 2. They were out of food by 12:45.
I told my whole crowd about them. I said, you get down there and you spend some money because we got to keep them coming back.
Tremendous showing. I was one of the last people to get a sandwich, and it was really good. And they said they did not expect this, and they will come back. All we need to do is ask them. They will come back. They were very, very appreciative of the response they got in Kenmore. Chicken Fix said the same thing. They ran out of food too. They had to leave a little early. The little parklet on Saturday was just filled with people, and they were sitting and using the tables and eating. Kids were playing, and it's amazing to me, the parklet, the games are still there. They haven't disappeared. Only one of them broke. One of them's a little broken. I mean, it's just amazing. The chairs are there. Everything is there. So I was really glad to see that. The Kaboom, I shot a video today for Kaboom. We've been asked to do a presentation. They wanted some voiceover and a video of our parks and what we're doing for the kids. They were looking for about a minute's worth. We're going to be featured next week as a playful city. And there are an announcement or two, but they're embargoed until next week, so I will get you the address, and you'll have to look and see what's going on. The only other thing I have is, please think about the Purple Light Project. Mount Lake Terrace does it, and I think it's a really good idea, and so I will be bringing that back. And those of you that can come to the Sound Cities Association networking dinner on the 1st of July would be greatly appreciated to have a Kenmore showing. So, with that, if there is nothing else to come before us, we are adjourned.